Hello, and welcome back to Live Well and Prosper, where we break down complex health topics to help you better understand your body. Today, we're diving into the world of cholesterol, specifically low-density lipoprotein cholesterol, also known as LDLC, and its role in cardiovascular disease. Picture LDLC as a delivery truck, carrying cholesterol to your arteries. But here's the thing, when there's too much of it, it tends to dump the cholesterol into your arteries. Over time, this can cause blockages leading to a condition called atherosclerotic cardiovascular disease, or ASCVD. Now imagine if we could prevent the blockages before they even start. That's exactly what primary prevention is all about. By reducing the amount of LDLC, we can lower your risk of heart disease. In fact, studies have shown that reducing LDLC levels can help protect the heart, even in people who don't yet have heart disease. So how do we decide who needs to lower their LDLC levels? It's all about your risk factors. Let's say we have a seesaw. On one side, we have your LDLC levels and your risk of heart disease in the next 10 years. On the other side, we have the potential benefits and downsides of taking medication every day. We want to balance the seesaw, and that's where healthcare providers come in. In your 20s or at your first doctor's visit, your healthcare provider will measure your cholesterol levels and use these numbers along with other risk factors like high blood pressure and smoking habits to estimate your risk of heart disease in the next decade. Based on your risk, you fall into one of four categories: low, intermediate, high, and very high. Your treatment plan will depend on which category you fall into. For example, if you're at high risk, the potential benefit of medication might outweigh the downsides, whereas if you're low risk, lifestyle changes might be a better fit for you. Now let's talk about a class of medications called statins. You might be wondering, why statins? Well, think of statins as a superhero in our story. These medications have been shown to reduce LDLC levels by about 30%, potentially leading to fewer heart-related events. But like any superhero, they're not invincible. The benefits you get from statins will depend on your individual risk profile. For instance, a 45-year-old woman who doesn't smoke, has normal blood pressure, but has high LDLC levels might have a lower risk compared to another person, a 60-year-old man with the same LDLC levels. So while both may benefit from statins, the absolute risk reduction is going to be greater for the man. The highest dose of statins is generally reserved for those with very high LDLC levels. In some cases, this could be a sign of a genetic condition called familial hypercholesterolemia. But for those who have high LDLC levels without this condition, high-dose statin therapy is usually recommended. On the other hand, if your LDLC levels are lower and your 10-year risk of heart disease is between 5 and 10%, your healthcare provider will discuss with you the pros and cons of statin therapy. This is because while statins can lower your relative risk of heart disease, the absolute benefit you get might be smaller due to your lower overall risk. So to wrap it up, LDLC plays a key role in your heart health. Keeping your levels in check can help prevent heart disease. Remember, it's all about balancing the scales and finding the treatment that works best for you. So that's a wrap on today's video on LDLC and its role in heart disease prevention. If you found this video helpful, don't forget to like and subscribe for more easy to understand health education. Stay healthy, everyone, and we'll see you in the next video.